There's a question I get is how dire of a situation are we in with our hospitals? I'll be quite frank. The number of COVID patients in our hospitals here in the Triad area is pretty high. It feels a little tight and uncomfortable, but it's not dire. And one of the issues that we're having is that we have staff who also are getting COVID, most of them unvaccinated, by the way, and which is why one of the reasons why we have a vaccine mandate that we're putting in place in our healthcare systems, because we need our staff to not get COVID. This is one reason. So when our staffing gets a little tight, then it becomes a little harder. We are not having alternate care plans in place at this time. We are not in a place where we're having to cancel elective procedures. You do not need to worry that our hospitals can't take care of other emergencies. So if you're having chest pain at home, we still need you to dial 911 and come to the hospital. If there's something that you've been putting off seeing a doctor, you need to go to the doctor and get that done. So please don't put off medical emergencies or medical necessities. Things aren't that dire, because we know how to deal with these in our healthcare systems. We did it in January. We can do it again. I was asked, does this mean if I have a stroke that the care I get in the hospital won't be as good? No. If you have a stroke, the care you get in the hospital will be just as good as in a non-COVID time. There's no worries about that. If we have to change staffing around a little bit, we'll do it and put off elective procedures for a month or so.